Dr. Preet, you are you started Glamyo. You're using tech to a very large extent. How do you see tech coming in and taking some of the stress off from infra?
Hi. So first of all, thank you, Business World. Right. So I'll give you a brief intro about Glamyo. So at Glamyo, we are reimagining the elective surgery space, and we are utilizing the underutilized or spare capacity which is already available in the system. Right. So just for starters, there are 44,000 hospitals in the country. Roughly 50% to 40 to 50% is the capacity utilization at on an average in these hospitals. So this is to say that instead of counting them as 44,000, you can say that they're roughly 22,000 only, right? So 22,000 of the hospitals are not being utilized in the private space, right? Now, COVID has accelerated certain sort of innovations in the healthcare delivery design, right? So most of the healthcare delivery design earlier was focused on generating the patient from a nearby catchment area and relying on sort of servicing the demand in the nearby 3 to 5 kilometer radius, right? Because healthcare is local, right? For most of the cases, unless the patient is driven by a star personality doctor, let's say if he wants to sort of get operated by Dr. Naresh Trehan, he would, let's say, travel 100 kilometers, right? But otherwise, he would just want to be operated in 5 to 7 kilometer radius, right? Now that was the bane which was existent in the system for very long, right? That we have lesser capacity is a known fact, and that is not going to change in next 20-30 years by a magic wand, right? That will gradually sort of improve. But what can we do to improve the utilization of the current capacity? Now that is where a startup like Glamyo Health sort of comes in, right? So what we do is we essentially help in utilizing the existing or the better utilization of the existing infrastructure. Now that is very important, more so after COVID accentuated the inefficiencies and insufficiencies of the healthcare infrastructure.